Hi guys, my name is Grace Baur, and today I'm going to be sharing my doctoral capstone experience looking at effective teaching strategies during level 2 fieldworks and also the development of an eSTIM protocol for a neuro outpatient setting. So fieldwork is one of the most critical points for OTs, and fieldwork educators often don't have very much training before taking on the educator role. So I wanted to look at the question, for healthcare preceptors, what teaching strategies are most effective in a clinical care environment? I looked at graduate level students in one-to-one student educator models, and I wanted to focus on studies that reported on specific teaching strategies that were implemented in clinical care. I started out with 8,725 articles to screen for title and abstract, and ended up with 13 to do my scoping review. After completion of iterative concept mapping and thematic analysis, I ended up with 3 main themes of providing effective feedback, maintaining student-centeredness, and implementing structure in fieldwork, and 6 key ingredients that you can see to the right here. All of these key ingredients had a huge impact on facilitating effective teaching strategies in the clinical setting. I used Cincinnati Children's Legend System to determine if they were good quality or lesser quality, and I had a mixture of both types of qualities, but I had a high frequency of articles presented in all of my themes. So I took the implementation analysis and I created a implementation checklist that I went over with 8 key stakeholders to determine if the teaching strategies were feasible, acceptable, and appropriate. I also completed policy reviews, which were supportive of my protocol. And finally, I did observations of 3 current level 2 student educator pairs and looked at the fidelity of the teaching strategies that they were already implementing. This pie chart, as you can see, showed that 42% of the strategies were already used as described, and 51 were not used or their use could be improved. So that determined what I looked at. And then after the stakeholder interviews, I was able to identify barriers of feasibility, acceptability, and appropriateness, and develop strategies to overcome them, including strategies for productivity changes, resource acquisition, and addressing educator burnout. And I also was able to develop a new algorithm, as you can see here on the left, that really incorporates the complex interaction between the student, the fieldwork educator, and the clinical coordinator throughout the 12-week fieldwork experience. And this is made under the situational leadership model, which is a really great model that keeps it very student-centered and student-oriented throughout the experience. Before I left, I was able to leave them with some key deliverables, including a fieldwork educator binder, a level 2 student binder, some online exit interview surveys, an updated behavior and learning contract, and level 1 student expectations and performance objectives. I was able to do a lot of really cool things in my time there, and hopefully left them with some lasting resources. On the other hand, I also worked in the outpatient neuro department to work on an eSTIM intervention literature review. So I looked at 32 articles that had topics of FES, NMES, eSTIM for shoulder pain and subluxation, and for TENS and sensory STIM. And I created this algorithm. This follows their Chattanooga Vectrogenesis eSTIM unit, and it's targeted and arranged by the purpose of eSTIM. So this was a very user-friendly algorithm that I created and implemented in the inpatient and outpatient settings. I was able to do a lot of really cool things at my time there to maximize the functional recovery of these neuro patients, including kinesiotape, driver prep, dynavision, splinting, and more. And I got to do some really cool things like visiting driver rehab, observing in surgery, attending rounds, and observing the healthcare pathway for neuro-based diagnoses. Christ had a lot to offer, and I had a wonderful experience there. So I hope that this was helpful and that you learned a little bit about my project. I was able to do a lot in my time there and just really enjoyed the experience. And I feel like I'm going to be a better fieldwork educator and clinician out of it. So thank you so much for your time.